patient is currently stable and is in isolation at the Brownlee Hospital pending transfer to the UK's high-level isolation hospital in London at the Royal Free Hospital. The risk to other people as a result of this confirmed Ebola case is deemed to be extremely low.
A second patient is being tested for the Ebola virus in Scotland. This comes on the heels of the first confirmed Ebola case in the United Kingdom. That first confirmed patient has been moved to a specialist facility in London for treatment. In both cases, the patients were healthcare workers who had recently returned from West Africa. But authorities say the second patient is considered low risk and has had no known contact with the first victim. And in fact, the second patient is not known to have any contact with any infected Ebola patients at all. But because of the highly contagious nature of the disease, authorities are being extremely cautious. Joining us now to talk more about the Ebola virus and a new test for the disease, Newsmax Deputy Health Editor Nick Tate, and author of the Obamacare Survival Guide. And Nick, this is great. A new test has been approved. Tell us how it works. This is amazing. It's going to save a lot of lives, I imagine.
It's really a breakthrough. There's no question. I mean, as these new cases indicate in the UK, we're not out of the woods yet in Ebola. And so what this new test will do is it will allow doctors to be able to assess within a 3-hour period whether people have Ebola or whether they have some other condition. There's a twofold benefit here. One, getting those diagnoses done quick speeds treatments when they can be most effective to people in early stages. And secondly, it will allow doctors to rule out those cases of, say, flu or other viral infections that are not Ebola so that they can kind of treat those people appropriately as well. Now, right now, it's only approved for use in emergency circumstances, but the expectation is that the FDA may, in fact, more widely license it for use in other settings so that we could see that this kind of test show up in American hospitals at some point.
You know, what's great is the world came together on this, and it's fantastic to see what the medical community and the scientific community came up with. We're actually kind of seeing the fruits of the labor and hopefully more advancements down the pike.
And sometimes it takes a crisis like this really to push medical science this way, and it's happening.
Yeah, and it's great too to see other nations kind of following suit and everybody coming together on this one. I want to change the subject, talk about Alzheimer's. Alzheimer's and an MRI, how does that work?
Well, right now there are MRI tests that you can do. You can look into the brains of patients who have Alzheimer's, and they see these characteristic proteins. They're called amyloid plaques, and they form in the brain. They form these clumps, and they lead to the memory loss and the cognitive problems. But this new test, researchers are able to come up with a device that uses an MRI to identify toxins that are precursors to those amyloid plaques, meaning that they lead to the development of these Alzheimer's-causing plaques. Getting that level of diagnosis that early could allow people to take medications that can slow down the progress of Alzheimer's. And that's really the key, because there is no cure for Alzheimer's. No effective treatment. All the drugs really do is they slow down the process. So if we can identify those individuals early, sometimes even before they have symptoms of memory loss or cognitive declines, that will increase the likelihood that treatments and drugs will actually be effective for them.
A lot of people right now going to healthcare.gov trying to get their insurance for the end of the year. If you remain uninsured, talk about how you're really going to get hit in 2015.
You are. Next year is the first year that you will have to pay a tax on your when you file your taxes in April if you did not have insurance last year. It's a 1% of income tax. But next year, that fee, that penalty doubles, so that when you're filing your taxes for 2015, it's a 2% penalty. And I think that there's a study that was done by the Kaiser Family Foundation, nonpartisan organization. They found that fewer than 3% of Americans know that that tax and that penalty is going to double. So I think there's going to be a lot of rude awakenings for folks who will discover when they file their taxes that not having insurance is actually going to cost them a bundle. And you don't just pay for yourself, you pay for every member of your household that does not have insurance. Spouses, children, and the calculation is kind of tricky. It's going to be a lot higher than I think a lot of people expect.
And also, the deadline to sign up for the ACA is March?
It's actually February 15th.
February 15th. So
March was last year. This year it's February 15th. Probably next year it will be even closer, and there will be less time. And the truth is that the fines continue to rise after the next 2 years. In 2016, they go up to 2.5%, and they continue rising as a way to kind of drive people to have insurance under that individual mandate if the Supreme Court upholds the law next year. So there are some questions there.
But like procrastinators like me who do their taxes April 10th,
Right.
you can't retroactively go back and sign up for the ACA. So you're pretty much stuck, right? You're going to have to pay that penalty.
There'll be nothing you can do about it at that point. That's why you need to be deciding now how to plan and prepare for it. You need to know what's coming. I mean, our message here has always been be a savvy consumer. Know what your choices are. You can't just wait to be told what's going to happen, or what, in this case, what you don't know really could hurt you financially.
And then quickly, how are the numbers right now for people signing up?
They've got, I think that the latest numbers show it's almost 7 million Americans have signed up so far, but as we said, there's still another 6 weeks or so, so those numbers are likely to go up.
Okay. Not sure if you're a yoga fan, but apparently we're hearing some really positive news when it comes to yoga and being heart healthy.
That's right. I am kind of a yoga fan. In fact, I like the hot yoga. What the researchers have done at Northwestern University is they looked at about 36 studies of the benefits of yoga, and what they found is that the heart benefits are as significant as aerobic exercise. So the idea that you have to go to the gym and be huffing and puffing for an hour at a time is just not true. What they found is that people that practice yoga have a lower blood pressure, they have lower levels of stress, and that leads to a greater heart health status for them. So it could be that for people who are particularly older or who have health problems and they really can't go through the rigorous exercise or more vigorous exercise, yoga will become a positive option for them. That's good for their mind and for their heart.
So do you recommend the 70-year-olds go out there and do the hot yoga? What is it, like 100 degrees inside that room?
You need to be careful with that because the
incrementally,
temperature gets high. That's right. Try the low-impact yoga first and then work your way up.
All right, throw the DVD into the yoga or maybe watch one of those shows on TV
That's a good
because
idea.
it is great exercise.
Absolutely.
All right, the flip side is eating poorly over the holidays. I know a lot of us gained weight. I know I gained a couple of pounds. Now we're going to attack those New Year's resolutions, but you're hearing there's actually a decline in donuts?
Yeah, this is a great, this is my favorite health story of the day. There was research that was done that looked at what people are actually eating, surveys of dietary trends, and what they found over the last 10 years is that we as Americans are eating something like 25% fewer donuts and pastries. So I think what this means is that people aren't eating the sugary foods that we know cause heart problems, they cause blood sugar problems, they cause diabetes. I think folks are finally getting the word that it's really sugar and it's carbs that are a problem, not necessarily fatty foods. And I think that's been a major shift in nutrition, and it's starting to show up in the food surveys.
All right, so put aside those donuts. Start attacking all that healthy food for the new year. Hey, Nick, thank you so much. Thank you very much to Nick Tate, author of the Obamacare Survival Guide. Be sure to take the National Medicare Survey. Tell Congress what you think of the recent changes to Medicare. And we're coming right back right here on Newsmax TV. We got a lot more to talk about. When we return, a look at what's happening on Wall Street. Jeff Yasteen joins us right after the break as we're finishing up 2014 and we're looking ahead to see what the economy is going to be like in 2015.